Before I say a single word about your heart, I want you to do something with your hands. Put down whatever you are holding. Sit up just a little straighter in your chair. Place the index and middle finger of your right hand on the inside of your left wrist, just below the base of your thumb. Press gently. Move the fingers around if you have to, because the pulse is not always exactly where you expect it. When you feel that quiet little tap underneath your skin, do not let it go. I am going to give you exactly 30 seconds. You are going to count every single beat you feel in those 30 seconds. And then you are going to double the number. That is your resting heart rate, right now, on this ordinary afternoon in your own living room. Write it down. Write it on a napkin, on the back of an envelope, in the corner of the newspaper. I do not care where, just write it down.
Because in 14 days, I am going to ask you for that number again, and I want you to be able to find it.
Now look at what you wrote. If that number sits somewhere between 60 and 75, take a slow breath of relief, because that is the gentle, well-trained beat of a heart that knows how to rest. If it sits between 75 and 80, you are in the territory where most people over 60 live, and you are not in trouble, but you are not finished either. And if your number is above 80, please do not panic. Do not close this video, do not call anyone. I want you to pay very close attention to what comes next, because that number is not a verdict. It is a whisper. And by the end of our time together, you will know exactly what it is whispering and what to do about it. Most people over 60 have never measured this number in their own home. They have heard it called out at the doctor's office, glanced at it on the side of a blood pressure cuff, seen it flash on the face of a wristwatch, and forgotten it before they reached the parking lot.
Today, that ends. Today, this number becomes yours. And before we are done, you will own 3 numbers, not 1. You will know 4 practices, gentle ones, that lower your resting heart rate without a single pill. And I will hand you 4 clinical insights at the very end about everyday habits that are quietly keeping your heart beating faster than it needs to. A morning beverage, a sleeping position, a food category, a breathing habit so automatic you have never once questioned it. We will get there. But first, I want to tell you why the textbook is incomplete. You may have read somewhere that a normal adult resting heart rate is between 60 and 100 beats per minute. That range is not wrong, but it was built for the average adult, which usually means a 35-year-old in a clinical study. A heart that has lived 60, 70, 80 years does not behave exactly like that heart. Your vagus nerve, the long quiet brake pedal that tells your heart to slow down, weakens a little with the decades. Your stress response sharpens, your sleep fragments, your morning rituals shift, and so the range that matters for you is narrower and lower than the textbook will tell you. For an adult over 60 who is in good cardiovascular condition, a resting heart rate between 60 and 70 is the quiet ideal. Between 70 and 80 is acceptable but trainable. Above 80, sustained, is a signal that the engine is idling too high. And the engine that idles too high wears out faster than the one that hums at a gentle rest.
That is the metaphor I want you to carry with you for the next hour, the next week, the next year. Your heart is an engine, and a healthy engine at rest does not roar. It hums. It idles. It conserves itself for the moments that ask for power. A resting heart rate is not just a speed. It is a window into a quiet conversation between your heart and your nervous system. A conversation about whether your body believes, deep down, that it is safe. So let me give you 60 seconds of science before we go any further, because you deserve to know the why before I hand you the what. Every beat of your heart is the result of 2 systems pulling against each other. The sympathetic nervous system is the accelerator. It speeds the heart up when you stand, when you climb stairs, when you remember a worry. The parasympathetic nervous system, carried mostly along the vagus nerve, is the brake. It slows the heart back down when you exhale, when you rest, when you laugh, when you feel safe. A resting heart rate is essentially a measurement of how strong your brake pedal is. A low resting rate means the brake is firm and the nervous system is calm. A high resting rate means the accelerator is winning. And here is the part that almost no one explains to a person over 60. You can train the brake.
You can strengthen the vagus nerve, You can lower your resting heart rate by 8, 10, 12 beats per minute in a matter of weeks, without medication, without strain, without anything more punishing than a careful breath and a gentle walk. I have watched ordinary people do it. I am going to show you how.
But before we get to the practices, you need to know the three numbers that actually matter. The one you just measured is the beginning, not the end. So let me give you the first. The first number is what I want you to call your morning baseline. This is the truest single window into your cardiovascular health, and it is measured before your feet ever touch the floor. Tomorrow morning, when you wake up naturally, before you sit up, before you reach for water, before you swing your legs out of bed, find your pulse the same way you did a few minutes ago. Count for 30 seconds. Double it. That is your morning baseline. For a well-conditioned adult over 60, this number should sit between 55 and 70. Between 70 and 80 is common but improvable. Above 80 on a quiet morning day after day is the signal that your nervous system is starting its day already revved, and we will fix that. The two things that ruin this reading are getting up to use the bathroom first, which raises the number by 5 to 10 beats, and checking it after drinking coffee, which can falsely elevate it for hours.
Measure it before either. If your morning baseline is higher than your daytime resting rate, that is unusual and worth a conversation with your doctor. If it is lower, which is normal, that is the number you want to lower further over the next 2 weeks.
The most common misreading of the morning baseline is dismissing a number above 80 as just how you are. It is not. It is trainable. It is information, not a verdict. The second number is the one almost no doctor will mention to you in a 12-minute visit, and it is, for adults over 60, a stronger predictor of cardiovascular longevity than the resting rate itself. I want you to call this your recovery number. Here is how you find it. Sit quietly for 2 minutes. Measure your resting heart rate the same way you have been. Then stand up slowly, walk gently across the room and back, sit down and immediately measure again. Then wait 1 full minute, sitting still, and measure a third time. The difference between the second measurement and the third measurement, between the just after and the 1 minute later, is your recovery number. A healthy adult over 60 should see that number drop by at least 12 beats per minute in that first minute of rest. 18 beats is excellent. 20 is exceptional.
If your number drops by fewer than 10 beats, your vagal tone is weak, and that is exactly what the next 2 weeks will improve.
What this number is telling your body is how quickly your nervous system can shift out of activity and back into rest. A heart that recovers slowly is a heart whose brake pedal is sluggish. A heart that recovers quickly is a heart that has been trained, by habits or by genetics or by both, to find calm on command. And calm on command is what protects you from the cardiovascular events that arrive without warning. I want to pause here and tell you about a study I think about often. Researchers followed 8,000 adults over the age of 65 for 12 years. They measured everything you would expect, but they paid special attention to that recovery number, the drop in beats per minute 1 minute after gentle activity. What they found was striking. The adults whose heart rate recovered by 12 beats or more in that first minute had a 38% lower risk of a serious cardiovascular event than the adults whose recovery was sluggish. 38%. The resting rate alone did not predict it nearly as cleanly. The recovery number did. That is the moment, when I read that study, that I started asking every patient over 60 to measure not one number, but two.
Thoughtful. So now you know the resting rate and the recovery number. There is one more concept to give you, and it is the one most people have never heard of because it sounds technical, but I am going to explain it the way I would explain a clock to a child. The third concept is called heart rate variability. Do not let the phrase intimidate you. All it means is this. A healthy heart does not tick like a metronome. It does not beat at exactly the same interval every single time. Between one beat and the next, there is a tiny, almost imperceptible variation in the timing. And here is the surprise. A heart that varies slightly between beats is healthier than a heart that ticks like a clock. The variation is the sign that your nervous system is alive, responsive, listening to your breath, your posture, your thoughts. A heart that ticks too evenly is a heart whose nervous system has gone quiet in a way it should not. You do not need to measure this number with equipment. The 4 practices I am about to give you will improve it naturally, alongside your resting rate and your recovery number. But I want you to know it exists, because it is the deepest layer of what we are training. 3 numbers. The morning baseline, the recovery number, the heart rate variability. Together, they form a picture of your cardiovascular health that one number alone can never give you.
Now we move from measurement to action. 4 practices, less than 20 minutes a day across all of them. And I promise you, if you do these consistently, you will see your morning baseline drop by 2 or 3 beats within the first week, and by 8 to 12 beats within 8 weeks. I have watched it happen too many times to doubt it. The first practice I want you to call the 4-6 breath. Twice a day, once in the morning before breakfast and once in the evening before bed, sit comfortably in a chair with your feet flat on the floor. Breathe in slowly through your nose for a count of 4. Breathe out slowly through your mouth for a count of 6. The exhale is longer than the inhale, and that is the whole secret. When the exhale is longer than the inhale, the vagus nerve activates, and the brake pedal of your nervous system gets firmer with each breath. Do this for 5 minutes. That is roughly 30 breath cycles. The 2 details that 90% of people get wrong are these. They breathe with their chest instead of their belly, which signals stress to the nervous system, and they make the inhale too forceful. The breath should be quiet enough that someone in the next room could not hear it.
By the morning of day 4, you will notice your morning baseline has dropped by 1 or 2 beats. Some people describe it as the chest feeling looser. If you have any condition that affects your breathing, do this for 2 or 3 minutes instead of 5, and let the count be 3 in, 5 out. The second practice is a gentle daily movement protocol, and I want to be careful with the word exercise here, because what you are doing is not exercise in the punishing sense. You are having a deliberate cardiovascular conversation with your heart. 20 to 30 minutes of continuous gentle walking, 5 or 6 days a week. Not a stroll where you stop to look at things. A steady, rhythmic walk where you can still hold a conversation, but you are breathing slightly deeper than at rest. The mechanism is this. When you ask your heart to do gentle, sustained work, it adapts by becoming more efficient. The chambers fill a little fuller. The output per beat increases. And because the output per beat is higher, the heart needs fewer beats per minute to deliver the same amount of blood. That is how your resting heart rate drops. It is not magic, it is your heart becoming a better pump. If walking outdoors is difficult, walk inside, around the rooms of your home, for the same amount of time. If you have knee or hip limitations, do 20 minutes of seated marching, lifting one foot, then the other, in a steady rhythm. The mechanism still works. The third practice is a hydration and electrolyte rhythm, and this one surprises people. A mild, persistent dehydration, the kind most adults over 60 live in without knowing it, causes the heart to beat 4 to 8 beats per minute faster than it needs to. The reason is simple. When you are underhydrated, your blood volume is slightly lower, and your heart must work faster to circulate the same amount of oxygen. The fix is not to drink a lake of water. It is to drink 1 full glass of water within 15 minutes of waking, before coffee, and then a half glass every 2 hours through the day. Add a small pinch of salt to one of those glasses, especially if you are on any medication that increases urination. That pinch of salt holds the water in your body long enough to do its work. By the end of the first week of doing this, you will feel less fatigue in the late afternoon, and your resting rate will settle by 2 to 4 beats. The fourth practice is an evening wind-down sequence, and this one matters more than any of the others for producing a lower morning baseline. The hour before bed is when your nervous system either learns to rest or learns to stay alert. So, in that final hour, do 3 things. First, dim the lights in the room you are in, or turn off the overhead light and use only a lamp. Bright light suppresses melatonin and keeps the heart slightly elevated. Second, avoid heavy food in the 2 hours before bed. Digestion of a large meal raises the heart rate by 10 to 15 beats and keeps it elevated through the first half of the night. Third, in the final 15 minutes before lying down, do another round of the 4-6 breath. 5 minutes is plenty. What you are doing is training your nervous system to interpret bedtime as a safety signal. Within 4 or 5 days of doing this consistently, your morning baseline will begin to drop, because your overnight heart rate has finally been allowed to settle. So that is the plan. 20 minutes a day, total. 5 minutes of breath in the morning, 20 to 30 minutes of gentle walking, broken up however suits you. A glass of water in the morning and small ones through the day. An hour of wind down in the evening with the final 5 minutes of breath before bed. Morning, midday, evening. Simple, doable, repeatable. The one safety rule I will give you, and I want you to take it seriously, is this. If you experience sudden changes in your heart rate that do not match your activity, if you feel dizzy or faint, if you have any known arrhythmia or a recent cardiac diagnosis, please speak with your doctor before beginning the breathing practice or the walking protocol. The practices are gentle, but they are still active engagement with your cardiovascular system, and your doctor knows your particular heart in a way I cannot.
Now, as promised, the 4 clinical insights. These are the quiet habits that are raising your resting heart rate right now, and the simple corrections that neutralize them. The first is your morning coffee. I'm not going to tell you to give it up. I would not ask that of anyone. But the caffeine in a single cup elevates your resting heart rate for up to 6 hours after consumption. And if you drink it within 15 minutes of waking, you are training your heart to start every day already revved. The fix is this. Drink 1 full glass of water first, then wait at least 45 minutes before your first cup of coffee. That single timing change reduces the heart rate impact of caffeine by roughly half, because your nervous system has already settled into the day on its own terms before the stimulant arrives. The second insight is a sleeping position adjustment. If you sleep flat on your back, the weight of your chest organs sits more heavily on the right side of your heart, the chamber that pulls blood back from your body.
The right side has to work slightly harder all night, and your overnight heart rate runs 3 to 5 beats higher than it needs to. The fix is to sleep on your right side with a pillow tucked along your back to keep you there, or to elevate the head of your bed by 2 or 3 inches with a wedge or a folded blanket beneath the mattress. Within a week, your morning baseline will drop, because the right side of your heart has finally been allowed to rest. The third insight is about a single food category, magnesium. Most adults over 60 are mildly deficient, and magnesium is the mineral that stabilizes the electrical rhythm of the heart. The food sources are simple. A small handful of almonds or pumpkin seeds in the afternoon, a half cup of cooked spinach with dinner, a square of dark chocolate after the evening meal. On the other side, the food category that subtly disrupts heart rhythm is heavily processed food high in sodium and low in potassium. The fix is not a special diet. It is the addition of 1 magnesium-rich food per day and the subtraction of 1 heavily processed item from the same day. 2 weeks of that, and you will feel the difference in your evening calm. The fourth insight is the one that almost no one notices about themselves. You are probably a shallow chest breather. Most adults over 60 are. Watch yourself for 60 seconds. If your shoulders rise when you inhale, if your chest expands but your belly does not, you are breathing in the way the nervous system reads as mild stress all day long. The substitution is to consciously breathe with your belly. When you inhale, the belly rises. When you exhale, the belly falls. The chest stays quiet. Practice this for 1 minute at a time, several times a day, until it becomes automatic. Within 2 weeks, your resting heart rate will drop another 2 or 3 beats, simply because your nervous system has stopped interpreting your own breath as a stress signal.
3 numbers, 4 practices, 4 insights, and now, 1 rule to carry with you. I want you to remember this, the morning 60 rule. Your goal for the next 14 days and for the years beyond is a morning baseline that sits at or below 65 beats per minute, measured before your feet touch the floor. 65 is the gentle hum of an engine that knows how to rest. The morning 60 rule. Say it once to yourself. Repeat it to your spouse tonight at dinner. Mention it to a friend over coffee tomorrow morning. That is the entire video, distilled into a single number and a single phrase you can carry in your pocket. Now look back at the number you wrote down at the beginning of this video. Whether it was 72 or 85 or 90, that number is not a judgment. It is a starting line. I want you to commit to 14 days. The 4-6 breath, twice a day. The gentle walk, most days.
The glass of water before the coffee. The dim lights and the wind-down breath before bed. The almonds in the afternoon. The right side sleep. The belly breath whenever you notice. 14 days. And then, on the morning of day 15, before your feet touch the floor, you will measure your morning baseline one more time. And you will see, with your own fingers on your own wrist, what your heart can do when it is finally allowed to rest. Comment your starting number below. Whatever it is. I have seen people start at 90 and reach 72 in 2 weeks. I have seen people start at 78 and reach 66. There is no shame in any number. There is only the number and the work and the new number that follows. And before you go, I want you to think of one person. Not everyone in your life. One specific person. A spouse who has never measured their own pulse. A sister whose heart you worry about. A friend who never goes to the doctor. Picture their face. Share this with them. One person. By name in your mind. Your heart has been beating, quietly, without applause, for 6, 7, 8 decades. It has not asked for recognition. It has not asked for rest. It has only asked, in the only language it speaks, the language of a number on your wrist, to be listened to. Listen to it now. Give it the rest it has earned. I will see you in 14 days, with a quieter heart and a lower number. Take care of that engine. It has carried you a long way, and it has a long way still to go.